Swollen feet in seniors, also known as edema in older adults, is a common and uncomfortable issue. It may be caused by aging, poor circulation, sitting or standing too long, medications, or underlying health conditions like heart disease, kidney problems, or diabetes. Here are the most effective daily habits to reduce swelling in seniors' feet, explained in simple, easy-to-follow. Do gentle foot and leg exercises. Moving the legs improves lymphatic drainage and blood circulation. Try these simple exercises: ankle rotations, toe curls, leg lifts while sitting, marching in place. Ideal for seniors with limited mobility or arthritis. Limit salt intake in daily diet. Excess salt causes the body to retain water, leading to more swelling. Read food labels to check sodium levels. Avoid processed, canned, and salty snacks. Cook fresh meals with herbs instead of salt for flavor. Massage the feet daily. Massaging feet helps move trapped fluid and eases discomfort. Use gentle upward strokes toward the heart. Add olive oil or coconut oil for smoothness and skin nourishment. Professional foot massages by a caregiver or therapist are also helpful. Maintain a healthy weight. Extra weight puts more pressure on the feet and joints. Losing even a few pounds can reduce swelling and pain. Follow a balanced diet and get regular physical activity. Consult a dietitian for a senior-friendly weight loss plan. Avoid prolonged sitting or standing. Sitting or standing too long causes fluid to collect in the lower legs. Seniors should shift positions every 30 to 60 minutes. Use timers or reminders to move around. Stand and stretch if sitting, or sit and elevate if standing. Use foot baths and Epsom salt soaks. Warm water foot baths relax muscles and promote circulation. Adding Epsom salt helps reduce inflammation and pain. Soak for 15 to 20 minutes once or twice a day. Avoid very hot water to prevent burns. Wear comfortable and supportive shoes. Tight or unsupportive footwear can worsen swelling. Choose shoes with good arch support and soft soles. Avoid high heels or narrow-toed shoes. Orthopedic shoes or insoles can be helpful. Monitor medications that cause swelling. Some medications like calcium channel blockers, NSAIDs, or steroids may cause fluid retention. Do not stop taking medications without doctor's advice. Report any new swelling to your doctor immediately. Incorporate anti-inflammatory foods in diet. Foods like ginger, turmeric, pineapple, berries, and leafy greens help reduce inflammation. Omega-3 fatty acids found in fish like salmon are also helpful. Reduce processed sugar and red meat intake. Use olive oil for cooking instead of butter or margarine. Check for underlying medical conditions. Chronic swelling may be a symptom of heart failure, kidney disease, liver disease, chronic venous insufficiency. Regular health checkups and lab tests are essential. Early diagnosis helps in better swelling control. Keep skin moisturized and healthy. Swollen feet can lead to dry, stretched, or cracking skin. Use moisturizing creams daily to prevent skin damage. Avoid lotions with alcohol or fragrance. Keep toenails trimmed to prevent infections. Use cold compresses for quick relief. Cold packs help reduce inflammation and numb discomfort. Wrap ice in a towel and apply for 15 minutes. Do not apply ice directly to the skin, especially useful after a long day of activity. Avoid alcohol and smoking. Alcohol causes fluid retention and increases inflammation. Smoking reduces oxygen supply to the tissues and affects circulation. Reducing or quitting both habits can significantly reduce swelling. Seek professional help if needed for addiction support. Follow a daily walking routine. Walking activates the calf muscles, which push blood back to the heart. Just 20 to 30 minutes of walking daily can greatly reduce swelling. Use a walker or cane if needed for balance. Choose safe, flat walking surfaces.